with each session is to just check.
Okay. Hello?
And yeah, I'm still there.
Okay.
So it's just to make sure that obviously the understanding that we are having on the unit, we are kind of following up on that. So just a quick recap, in terms of what we've done so far. So if we look at this particular unit, the reason of studying this unit, when we look at international healthcare policy, as the name itself signifies, we are looking at understanding how the healthcare policy framework, the whole package actually works within a particular listed country, a country. That is the requirement for this unit. So what we've done so far is we've looked at picking up the National Health Service in the UK, and obviously the country that we've chosen is United Kingdom. So here we are looking at understanding, bits and pieces of this unit, taking the NHS and UK as an example to understand how a policy framework in the health context is put together with a focus on, the key things which the government law and legislation or acts in the Parliament actually create. So the first thing that we looked at, I think a couple of sessions back, was to understand how the formation of this policy happens. And we've looked at how the NHS came about after the post-World War II, how the health, the health framework was put together, and then the National Health Service was introduced. We also looked at, followed up with that, we looked into details like what are the key things which actually impact the formation of healthcare policy. For example, as a country, we're a country of immigrants or migrants, as you can say, or, from that angle, Britain has had a lot of people who have come in from different geographies and the histories, so the idea of to understand from that context is to look at what were the social and cultural context which were included in the healthcare policy framework. Things like it's free and impartial, it's available to all, one and all who is a British citizen or is a permanent resident in the UK, and the services are absolutely provided free of cost without any discrimination or any sort of reservations. Then we looked at some of the bits in terms of the key bodies which actually help run this National Health Service. So we talked about the three key things which over the years NHS has undergone a lot of change, but over the years what has happened is that there are certain subsidiary institutions which have come up under the framework of National Health Service. And these things were things like the NHS Act, the Health and Safety Act, the Health Act, which was introduced in 2009. We looked at the creation of 2 or 3 bodies like the NIHR, National Institute of Health and Research, and then we also looked at NICE, which is National Institute, which basically looks at supporting the NHS to drive some of these things. And then we briefly looked into other things, which is like the structure of NHS, what is the the role of CQC, the Quality Care Commission, which looks at monitoring and effectively ensuring that the implementation of the constitution of NHS is actually done in all the primary, secondary, and tertiary channels of care which it provides. Then in the last session, we looked at basically things like how do we look at the external influence of bodies like the World Health Organization, the UN. Very briefly, we looked at in terms of how do they look at working with governments or the various kind of services within different countries at a national and international level, and how do they coordinate the efforts of sometimes when you have to respond to natural disasters or calamities, then how does a coordinated response happen with the participation of these international agencies like the World Health Organization, United Nations, and things like that. Now, today, what we are going to do is look at the role of, understand the role of healthcare promotion. Now, the idea of studying so in sequence, in this chronological order, the idea of studying the role of healthcare promotion is to understand how sometimes, the government will look at, or the NHS in this case will look at, socio-political issues which are related to dealing with, attitudes and behavior of people, which could be within the, the private sector or the companies which actually work within the NHS, or pharmaceutical companies that we look at. the testing of drugs, which is done by the Food Standards Agency, and the organizations which basically look at regulating the promotions and how do these promotion campaign policies are then rolled out in the interest of the public, and what are the benefits which these healthcare promotions. When you say promotion, it's like a campaign to run, like say for example, when we look at the 2 or 3 major killers which are now we see as against the because of the modern culture that we have adopted. The sitting culture, for example, obesity is a major killer. So by 2050, some of the studies indicate that obesity is going to be the biggest spend which NHS will have to do to tackle obesity and obesity-related problems, which lead to problems of heart, diabetes, as you know. So, how do we look at NHS or the National Health Service now accommodating these kind of things, which are conditions which we are getting because of the modern day lifestyle, to be able to counteract, and this to a certain extent is currently dealt through the route of doing promotions to create awareness or spread awareness of these modern day diseases, disorders, whatever we call it, and how they were going to be tackled is under the remit of the Learning Outcome 4. So here we understand basically the role of public health and health promotion campaigns in general. How do they disseminate information, create awareness, and look at generally, what do you call, creating a link between people's understanding of how these services, how these disorders can develop, and how, if in case they are diagnosed or have this problem, then how these can be then treated. So we are going to look at this particular learning outcome, and then in this we are going to cover a couple of things like understand what is a healthcare promotion first. Just like any other business, and we look at any other field, there will be companies, businesses which will do promotions or some sort of activities which will create more awareness, sales, demand, and those kind of things. So that, if I translate literally into the aspect of how the promotions are done, this will be done in the case of healthcare promotion within the NHS. The second bit that we look at is what is the role which different individuals, stakeholders play in this promotion, and that is going to be looking at public bodies, that is going to be looking at individuals who receive services from the health and social care, from the NHS. We look at certain other bodies which basically include non-government organizations, and we will also look at the role of international organizations. And then towards the end, what we will look at is a framework of what you see on the screen as of now is a slide which basically highlights the framework of the healthcare promotion, but we will study how they are rolled out. And last but not the least, we will also look at basic elements of understanding, bits related to a report, which I will share with you. It's a report which is published once in 3 years, and this kind of looks at the review of the healthcare provisioning from a route of, promotions, from a route of how much budget, how much money is allowed under the, how much money, let me rephrase, how much money which NHS can actually spend in terms of the NHS budget they can spend in terms of these promotions, how the allocation of this budget happens, what are the national campaigns which NHS is currently focusing on, and then how do they look at setting targets for these promotions, so that they are not just money which is being sent by the government to tackle obesity, saying that we'll do this, we'll do that, but how does it set tangible targets is what we will need to look at in this particular provision. Okay, so it's just a brief overview, but that is where we are heading towards now, is to understand why is there a need to raise awareness, why is there a need to spread information, or provide additional information to people or users of the National Health Services, because there are lots of things that are currently being identified which will drain the budget of NHS because of our modern day lifestyle. Is that okay?
Yeah.
Okay, so let's look at some of the key things in the slides first. So let's go through some of the slides, and we'll then at some stage do a bit of discussion to look at broadening what we are studying. Now, the first thing that we look at in particular is how do we define healthcare promotion? What is health promotion? If you don't look at the slide, read it and just look at the term, which is promotion, and then add the word health to it. What do you think is health promotion?
To help the individual to improve their lifestyle in different, like physically, mentally, and social and well-being.
Yes, absolutely correct. So when we look at the context of something called promotion, what we are trying to do is we are trying to basically share information or enable people, as you rightly said, to improve their health and their lifestyle. And what we want to be able to do with this process is basically, increase the awareness of how people can have greater control in terms of their health or health-related conditions. So the basic aim of healthcare promotion is to look at how do we reach out to the individuals to make them aware of the condition of their health, whether it's physical, mental, or in terms of social well-being, and what they can do to then identify these conditions and then take appropriate actions to basically solve a particular problem. So a case in point here would be that if, say, for example, we do see that in the younger generation now, weight is obesity or gaining weight is turning out to be a bit of a problem. And a lot of studies are currently being done in this context to identify why are children falling, or basically, they are gaining weight as compared to previous generations. So here, the government is then looking at creating promotional kits to be able to make the consumers aware of how and what type of foods or intake they should take, which allows them to kind of stay away from this condition of obesity. So when you go to a supermarket, for example, when you're buying foods, over a point in time, they've made it mandatory to, on the food in terms of labeling, they made it mandatory as a law to basically print the, the percentage of salt and sugars in the food that you're buying. So in most of the cases, when you look at fast foods, when you look at drinks, fizzy drinks and things like that, this has been identified in an area that you need to know what is the sugar and salt intake that you can get from a pack of crisps, or for example anything that you buy in the superstore, which is a fast food. And the idea of creating this awareness is to make you aware from the start that if you are eating the right set of things. So one of the very important campaigns which the government runs, and we see this on television, is one of 5 a day. That means if you have a 1 of 5 a day campaign in which they talk about that you need to get 1/5 as juice or fruit and 1/5 as vegetable, this promotes a healthy living lifestyle. So this thing which they are trying to promote is basically to raise awareness of how to live a healthy lifestyle, how to live a life which is free of illnesses and diseases. Is that okay? So this particular condition, conditioning, or the program which the government runs under the National Health Service in general will be termed as something called healthcare promotion or health promotion. Okay. Now, what are the activities which the healthcare promotion encompasses? What all does it include? So when we look at this campaign wherein they're trying to make you aware of even before you get a disorder or a disease or maybe fall ill, is something which is preventive healthcare, isn't it? So for example, one of the key examples which you get to see time and again, which the government promotes, is breast cancer screening or screening against any type of cancer. The reason why they are doing it is because there is no definitive cure identified apart from chemotherapy and prescription of drugs. So this is a lot of cost to the NHS, and if some of these illnesses or disorders, or for example, can be diagnosed at an earlier stage, then the treatment becomes easy. The patient does not need to go through a lot of discomfort, and at the same point in time, it leads to raising the awareness if they're able to do the promotions and generally raise the awareness amongst the people about this particular disorder. isn't it? So this is basically preventive. That means sometimes when you take out a car insurance, the reason why you take it out is that in the case of an accident, you are covered and the third party is also covered, to which you have collided with or had an accident with. But this is a precaution that you're taking. Otherwise, you would drive without insurance on the road, isn't it? But you take it out because just in case if anything eventually is to happen, even if it's not your fault, but you are covered for legal costs, medical costs, and your car and your vehicle is actually covered under the insurance cost. So So this is nothing but preventive, kind of a thing that you take, which is precautionary. So similarly, when we look at healthcare promotions, some types of promotions which are currently under the initiative, which are messages which are rolled out on TV, print, or otherwise radio, would be to look at raising awareness and basically making sure that you are able to take preventive steps to avoid that particular disorder or that illness. The other types of promotions we can look at, which are highlighted. So, for example, the first one we've discussed. The others are sometimes when you look at development of organization in terms of changing the way the lifestyle is. You're looking at influencing. You're looking at influencing the change of lifestyle using the vehicle of promotion. That means if the government is looking at providing, free meals in schools, the idea of providing these free meals in schools, there could be a number of reasons, but one of the key reasons why they provide these free meal schools is to ensure that at the early years of your life, you are able to develop a habit wherein you are able to eat balanced diet, or develop something wherein you eat a balanced diet and you get a good intake of, everything which is required on a daily basis to maintain a healthy lifestyle. So here, sometimes when we say, when you look at, companies which promote fashion products or, cosmetic products, what they look at is they try and get hold of these products in terms of a foothold with the younger audience. Because if you get them, hooked onto your product at a younger age, then you know that at some stage they will stick to you or be loyal or, keep using your product for a long period of time. So similarly, when you look at healthcare promotion, anything which is being done in the context of, for example, schools to promote health within schools or within the fields of education or an institution at that level is looking at promoting the concept of health promotion at an organizational level. So what they're trying to do is ingrain this as an activity that you should eat a balanced diet, you should eat on time, and this will help you maintain a healthy lifestyle. And that would be classified as something called, being done at the organizational level. An example of that is maybe at the school level, the providing of free school meals, right? Then the other options that we look at is sometimes when you look at public policies. A couple of years back, they banned the smoking in public areas. The reason why they did that was a lot of research actually showed that passively, even if you're not smoking, and if you're a passive smoker, that means you inhale the smoke of somebody who's around you who's smoking, also causes damage and also can lead to cancer or some sort of a cancer. So here, the creation of this particular law which banned public smoking, smoking in public places, essentially like restaurant, pubs, was influencing, influencing the outcome in terms of looking at making a policy, and that policy actually promoting the concept of doing away with the effects of, say, for example, smoking, at least in public places. So healthcare promotion can sometimes be also dubbed as that when they create this through the policy route. That means the government would introduce a law or a legislation which would ban it to be used or to be, prescribed in public places. And a good example of that is, the banning of smoking in public places when the government introduced a law some time back. And this again is looking at promoting the concept of, people not having to smoke passively or inhaling passively the smoke of, cigarettes and things like that, pollution and stuff. In particular, cigarettes is because of the fact they want to look at a long-term change and look at reduction in terms of these disorders from a long-term perspective. Okay. Then you look at other bits and pieces, which are, other types wherein sometimes you look at economic and regulatory activities. That means restriction on the sale of alcohol. So if you see over the years, in the last 2, 3 decades, the price of liquor or the price of beer, for example, has become, it's dropped by about, I don't know the percentage, but it's dropping continuously. And why is it dropping? The consumption is increasing, and the way supermarkets are actually promoting the concept of, you buy beers or happy days or, some sort of promotions and offers which are being put together, is leading to more of consumption. And this more consumption then leads to liver disorders, leads to other kind of problems and illnesses which NHS has to provide services for. So one of the key things that they are looking at is they are also apart from creating a policy or legislation, sometimes the government makes it a de-incentivizes. That means every year, if you see in the budget, the tax on cigarettes is increasing, isn't it? The tax on alcohol is increasing. They're putting some sort of a cess or an additional tax. So in order to kind of, de-incentivize the sale of these products. And again, this is from being looked at from a long-term perspective, that they want to look at tackling this, the menace of free or cheap alcohol by introducing economic pressures. And that sometimes when you get to see these promotions happening, they take a bit of a negative, view of whenever we think of promotion, we think of sales, offers, discounts. But in this case, they are kind of de-incentivizing by increasing the prices, so that it kind of is pushing you away from not buying liquor or cheap liquor or in bulk. Okay?
Yes.
Now, again, another form that we look at is with the advent of internet. What is happening is that our children or people at the young age, under 13, like for example, when you look at Facebook, the minimum age at which you can sign on and open an account in Facebook is 13 years old, because the government is looking at ways and means of sometimes how do you control the spread of information. Now, information related to, for example, sexual health, drugs, these kind of things that we are seeing is that people are getting hooked onto at a very young age. And the reason why they are doing, trying to restrict the flow of such information at a very young age is that at this age or at anything below 13, if you get hooked onto some of these things, then it is very, very detrimental to your health. It has a direct effect on your upbringing in terms of, your growth of the body and things like that. So here, the promotions which the government rolls out or the NHS rolls out are primarily to ensure promotions in terms of knowledge and information being made available to parents or people who have kids. And that is where they're trying to sensitize them that there should be barriers in the channels through which people, when I say people, children consume information. So it could be the internet, for example. Sometimes you look at, putting in a parental lock or, deterrents, essentially, which do not allow your children to reach a particular site. So parental controls are put in. So those are bits and pieces. Sometimes you will see healthcare promotion also happens is because they want to kind of provide information which is made available to people who manage children or manage vulnerable adults, and that is where they try and restrict the flow of information so that if they get access to it, then obviously it can lead to some sort of negative impact, and that is where you get to see also a form of promotion which happens. And again, some part of these promotion activities are happening in places wherein there are institutions of learning. So it could be school, colleges. We look at a lot of courses which the government is now prescribing tutors and teachers to do, like the checks we look at, which is the CRB check or a criminal record check or a DBS check as we look at. And these are things which are done because they want to ensure that the right people who have the right reasons to be in this particular field, say for example in the field of education, are allowed to teach and are allowed to have access to children, so that once they teach and once they promote and talk about the concept, it is done in a fair and very clear manner. Sometimes you look at healthcare promotion which happens in the case of environmental reasons. So for example, the introduction of the plastic recycling scheme, wherein the bottles have to be returned back in collection stations, wherein you will pay a little bit of an additional amount, but when you return the bottle, it'll help in recycling, and collections will happen, and that is where you'll get the money back. So sometimes you will look at healthcare promotions happen because of environmental reasons. That means you want to preserve the environment around you, whether it's the preservation of water, whether it's the recycling, and those are other reasons through which you can think of ways and means where the government will look at promoting these activities which look at conservation of environment. A lot of medical waste, waste in terms of syringes, bandages, things like that, is also controlled through this aspect, because they want to look at the concept of recycling so that it doesn't pollute water bodies, and it kind of can be easily recycled and disposed of in a manner which is not going to harm the environment. So there are a range of activities, as you can see, which are under the umbrella of something called healthcare promotion or health promotion. So in some cases it has very generic meanings, but in some cases it has very specific and direct meanings or correlation to the National Health Service. Is that okay, and is that clear?
Yes. Yes.
Now, who has the responsibility of promoting this? Now, it is not the, what the government basically says is that it is not just the responsibility of the NHS to look at putting out these, bits and pieces of information termed as promotion. It is a shared responsibility. That means people, whether you are working, whether you're studying, of all ages, healthcare professionals, other government organizations, and even private sector organizations, they all have the responsibility of promoting healthcare. That means they need to promote the right awareness of health and health-related routines, so that it leads to the development of a proper healthcare system, which is available to all at the time that they need, and at a place that they need it. Okay. Now let's look at some of the next few slides are primarily talking about what are the responsibilities. So what do you think are the responsibilities of individuals? We as people who use NHS and the services of NHS, what are our responsibilities in terms of promoting health promotion or promoting good health?
It's just like to look after the elderly people, or the people in general, individual within the city.
Yeah, that is absolutely correct. I think the main responsibility at our individual level is that we need to look at kind of having a healthy lifestyle. That means we need to be able to take care of ourselves. We should have a lifestyle which allows us to learn, work, play, or basically do our daily set of activities, and that should lead us to having a normal everyday life. And if we are able to have a balanced diet, for example, if we work out, and at some stage, we also look at having a balanced intake in terms of foods, that will in general lead to the promotion of a healthy lifestyle, which would mean that our lives are going to be more or less, illness-free or disorder-free. And from that angle, it puts an individual responsibility back onto people for them to create and have a lifestyle which basically promotes good health or well-being, essentially. When we look at, for example, community groups in schools, there the target is that when some of these programs are rolled out, they are directed at more or less some individuals or types of individuals. And here, the whole umbrella of promotion actually focuses on one of the aspects, which is to raise awareness about what are the benefits of leading a healthy lifestyle, what are the benefits of eating a balanced diet, what are the benefits of being fit. These are things which normally would be the role and the responsibility of individuals, but differentiating that to groups which are either community groups or schools or places of institutions where you go and spend time, like a health club, for example, or if you go to an activity center where you do swimming and things like that. The idea is there the responsibility is that they should be available. These facilities should be made available to one and all, which helps them in actually leading a healthy lifestyle. So individuals are basically looking at how do we maintain our well-being. But when we look at groups and institutions, if, for example, healthcare centers, or you look at fitness centers, these facilities have to be made available so that one and all within the general public can actually access these facilities to maintain a healthy lifestyle. So the non-government organizations, when we look at NGOs in particular, and we look at professional organizations, the bodies which work with the government to look at promoting this message, their role is basically to look at working with some of the private-public partnership in terms of organizations to basically advocate. That means their role is to basically look at a bit of research, look at a bit of data collection, and at some stage work in tandem with other organizations to be able to advocate what are the basic things required to be done to provide this safe environment. So when you look at such bodies, what you will find is there are lots of bodies which are NGOs like British Heart Foundation, for example, the Cancer Trust, the King's Fund. These bodies essentially work with the other bodies in the journal sector to be able to promote the role of basically awareness, dissemination of information, and to a certain extent they also help in research and developmental activity, and also help in shaping up the policies at some stage which the government brings out. So they are observers in the community. Their role is primarily being observers. They observe, they collect data, but at the same point in time, what they do is they also offer the promotion of healthcare through other organizations which are prevalent within the country. So British Heart Foundation is a charity, but what it does is it sponsors, for example, the 10K run, or the London Marathon, or the Manchester Marathon or Newcastle Marathon. But the idea is they want to be seen to be promoting the concept of well-being, and that is where they work in tandem with other organizations to sponsor these kind of events, which in general brings out people to look at leading a healthy lifestyle or participate in activities which could lead to a healthy lifestyle. Now, what are the key cogs that you will look at in the healthcare promotion is the government. Now they have lots of responsibilities at all levels, local level, the council level, and also at the national level. Now here they have to work constantly with all forms of authorities to get the message out there. Now when they do it through the parliament, it is more so in the case of coming out with a law or a legislation which becomes an act, and that then has to be followed by everyone. But they also work indirectly with local councils, and when we say other non-NGO organizations, wherein their key responsibilities to get the message out there, and in some cases they do the funding of this means to get the message out there. That means government works with Oxfam, and a lot of these trusts and charities like say for example the Christie's Hospital, and they give out grants which are given to these hospitals or these trusts to be able to do a lot of research and development, so that they are at the cutting edge of coming out with drugs or techniques which will minimize or help fight the diseases at some stage. So their working is at the level wherein they look at funding some of this work. They look at basically getting the information out there. When they look at the route of a parliament, it brings out law and legislation which becomes an act, and everybody has to follow. And in some cases, what they do is they get together in terms of getting the message out there, in terms of working with the local bodies or councils in particular. Okay. Now the role of international organizations. When we think of all these UN bodies, all the global bodies which kind of work together to look at disaster management, or in times of calamities which are considered national and international disasters, their role in particular is to create policy. That means they have to look at a policy creation wherein they are able to share the best practices across countries. Now, when you look at an example that I would give out here, would be when you look at the Ebola outbreak which happened in Congo and the Democratic Republic of Congo. When you look at the Ebola outbreak, there was an international coordination of efforts to look at minimizing the spread of this virus in the West African countries. Now, this was a response done by the national governments in conjunction with the international organizations like United Nations, the World Health Organization, the UN Children's Fund, and things like that. Because the outbreak was at such a vast scale, it meant that an international coordinated effort was required to promote the awareness of how this virus spreads and what things, and for example, the national governments had to take, or restrictions which had to be put in place pretty much immediately to kind of, limit the spread of this virus. So, for example, all flights, from the region coming into Europe and other countries were actually suspended or limited. They also looked at, the concept of the nations which had some sort of mechanism to kind of fight this, Ebola outbreak. So they asked for international assistance. That means we had British, some of the, what do you call, let's put it this way, some of the more specialist care people from Britain also went to look at, helping the country in terms of fighting the virus, how the elimination of the virus was done by kind of, creating cordoning areas or zones. That means the restriction of people to a certain extent was made limited because they did not want the viruses to actually spread and other peoples in other countries to contract this kind of or contract this virus. So sometimes you will see that the promotion is funded by these international bodies. That means they would look at mass awareness of the information happening on, let's put it this way, advertising of how to stay away from, the condition and how to save and restrict the spread of this virus was done through the national television, for example, campaigns were run. And in general, the coordination happens at the, international level with the government to government speaking in terms of how to restrict the flow of, people having this condition. So even after that, we see that, sometimes we did see that some of the nurses or people who were working in this, climate also contracted the disease. And because of which, what happened is they had to be flown back, and there was again, proper treatment and everything given to them to help ensure that they recover and, get back on their feet. So in general here, when we look at roles and responsibilities, what we are looking at understanding is that there are promotions which happen at every level. So it could happen at the individual level, and individuals have to play a role, and their role is restricted to making sure that they are able to lead a, kind of a well-balanced, healthy lifestyle. But when we look at a local level or at the national level, there is a response team which comes into place, and some of these promotions are then mass advertisement, on TV, air, and radio, and things like that. And this does, take effect because the spread of information and awareness is being done through multiple channels, wherein it is able to reach people at a very fast level. So a simple example of this would be in the winters, you have flu jabs which are made available by the NHS, and they're made available to, either children who are younger than 7 years old or adults who are over 60 years old. And the idea is this kind of a promotion when NHS does is to make sure that maximum number of people can get this jab so that they have, a trouble-free winter in terms of not contracting the flu or, not contracting the cold and the virus. So when we look at these kind of, activities which are happening at the individual level, at the local level, at the council level, and at the national level, and also at the international level, they require a different kind of response. And that response is seen in the implementation when you see coordination amongst bodies, amongst governments, and amongst international bodies which have been established. But it all leads to the awareness, creation of awareness, flow of information, so that they can try and restrict the spread of virus or a disease or a particular condition, and so that it affects less and less people. And that is where the concept of promotion comes in. That means proactively looking at making sure that the information is made available to people or a particular country or a particular level, at a particular level, so that they can not have this problem which is currently developing. And that vehicle is nothing but the vehicle of looking at promotion. Now, let's look at some of the, broadly look at one or two strategies in terms of and the framework which is put together when we look at how healthcare promotion is rolled out. Now, when we look at this particular slide gives you an idea in terms of how sometimes, the agencies will look at countering something which has already happened. But once it has happened, how they will look at then creating a flow chart or, some sort of let's put it there, some sort of a outreach plan, which can be termed as promotion so that these kind of conditions can be avoided in the future. So when you look at an illness, so for example, when you look at, say, fever, or when you look at hay fever, for example, when we look at this particular problem, the outcome is that it affects, people of all ages during the summer months. And then the focus is on, basically looking at getting hold of over-the-counter drugs which kind of treat hay fever. So the promotion which is rolled out is looking at, because this is a condition which happens every year. It is not something which is new. And every year this has to be looked at. So here the concept is that we know this kind of a problem occurs during the summer months when the pollen in the air is quite high, and there are people who are sensitive to pollen, and which leads to allergies and hay fever and things like that. So what the government has done now is they've created a strategy around it that just before the onset of summer and towards the end of spring, there are promotions which are rolled out on TV, air, radio, which kind of sensitize people in terms of the problem, and if they have this condition, what they are supposed to do in order to kind of avoid or kind of control this condition. And that is where the whole concept of promotion comes in. So do you see pharmaceutical companies or companies which basically sell drugs to treat hay fever advertising in winter or autumn? Do you see that happening? No, isn't it? So we don't see the advertisements of these companies which are advertising hay fever tablets and things like that, from a point of view of winter months or summer months. But in the winter months, you will basically see flu jabs being advertised, or things which are more pertinent to conditions which people can have during this month. It is something which you'll see more activity on. So the concept wherein this thing is becoming seasonal and this happens every year, there is a framework then being designed around when to promote, how to promote, and how much to promote, and in which months to promote. Is basically nothing but the healthcare promotion kind of framework, isn't it?
Yes.
If I know that my child, gets, let's say a running nose or cold every winter, what do? You normally would look at taking some precautions, isn't it? You'll get the winter clothes out, you'll make sure that they are dressed properly, and in some cases, you will advise them on certain things to do and certain things not to do in order for them to not to contract cold, isn't it, or catch cold.
Yes.
But even if they catch it, then you know exactly what is to be done, from a point of view of making sure that they quickly get rid of that condition and they're able to not miss school and other things with regards to that, common cold problem. So if you know that this is going to happen time and again, and if you know this is how it happens, what you do is at some stage you have an action plan which is ready. And the moment you see this is happening, you straight away put that action plan in to basically counter that situation. Isn't it?
Yeah.
So on a national level, if you see, if the government has to put together some sort of a plan like that, then in that case, what they do is they create something called a healthcare promotion or health promotion framework. And that framework is what we get to see when we see, the hay fever thing coming in the spring and the summer, late months of spring and onset of summer. And also we see the flu jab thing happening from a point of view of promotion during the onset of winters, isn't it?
Yeah.
You see a winter fuel allowance, nothing to do with the healthcare promotion, but you see a winter fuel allowance for senior citizens being, made available for, people, is because this is a framework. They know that some people are on pension and, they have to look at topping up their pensions or, the fuel allowances, because the heating bill actually rises in winters. Correct?
Yeah.
So this is nothing but, a framework wherein you basically look at, putting together something which can be run time and again, and that helps you to kind of deal with the current situation. And that would be the concept of, when it's happening at the national level, would be the concept of something called promotion. correct?
Mhm.
Okay. Now, going into some of the other slides, primarily just dwells into how do you look at the conditions in terms of self-care. Sometimes when there are things like symptoms like common cold and things like that, you are able to you don't need to go to a GP surgery. All you have to do is go to a pharmacist, get the over-the-counter drugs, and that should help solve that condition. So when you look at promotion as a concept, as a topic, it is strategic, and in some cases, what they've done is clearly segmented the framework to run in a way wherein for common illnesses like cold, fever, cough, you go across to the pharmacy wherein you don't need a prescription and you are able to straight away get the medicine to better the condition. But in some cases, when you look at something happening on a national level on a bigger scale and that requires antibiotics or requires a prescription, then in those cases, the promotional campaigns which the NHS runs are actually rolled out accordingly, and they take into account something called individuals, communities. They look at the cultural background, and in some cases they also look at obviously areas wherein sometimes you get harsh winters, for example. So in those cases, the payments to, say, for example, the winter fuel allowance is higher as compared to some of the other areas. So this kind of a differentiation has to be done when we look at promotion. So when we look at alcoholism, for example, here the concept of promotion is mostly targeting individuals, young individuals between the age of you're looking at 16 to 45, because that is where alcohol can do maximum damage, and once the damage has been done, the treatments are going to be required for them to come back to what you call is the normal lifestyle. So some of this is done from an angle wherein you look at targeting certain segments, certain age groups, and that is where the importance of lifestyle, individual attitudes, and also the socio-economic environment comes into being. You will see that people will tend to buy cheap liquor if they do not have the affordability, and that cheap liquor has the tendency to do more harm as against people who have maybe expensive liquor. Also does harm, but studies have proven that cheap liquor will do more harm as compared to good quality liquor. So here is where the socio-economic activity of the individuals also comes into play. So when we look at something like this, this is where the policy of healthcare framework in terms of promotional framework comes into being, and that is where we look at this concept wherein the framework then does create plans and create promotions or advertisements and awareness campaigns at various levels to be able to deal with these conditions. Now, there are two things that we also need to look at very briefly. One is, there are two or three approaches. There is something called preventive care, and there is something called, obviously, if you've contracted that disease or contracted that illness, then you need to get the, treatment. So government also promotes something called preventive care. That means they look at, when we look at the mass immunization programs, say, for example, children at the young age, one of the key things that they look at is we still have immunization happening in the country against measles, chickenpox, and these kind of conditions. Now, these conditions happen once in your life, but if there is preventive care done and immunization or injections given at the right point in time, at the right time in your life, then you can avoid some of these, threatening diseases. So this also requires promotion. So when you see, ladies going on maternity leave, they have a midwife assigned to them, and sometimes just towards, the start of the pregnancy, they take you through some of this preventive care approaches to look at how you do things or change your lifestyle during the time of your pregnancy so that you have a normal delivery or things like that. And that's an example of where you will see the triage team and the concept of all, which is to look at the various teams working within the NHS look at developing something called preventive care. That means there are conditions which can develop and you can have complications, but in order to avoid those complications, they do a lot of trainings, they do a lot of seminars, and ask you to be a part of those training and seminars along with your partner, because this is something which is life-threatening. This is something which can be more than life-threatening, and it can be life-changing kind of a condition. So that is where the goal is to look at, in those cases, the promotions and the awareness campaigns which are done have a very key role to look at sensitizing individuals on preventive approaches to such conditions. And this is something which also is done with certain set of individuals, or when you go through some, say, for example, some conditions during the course of your lifetime. Is that okay? Is that clear enough? Is that something that you can, correlate, or, you can follow? Naima, are you there? Hello? We have lost you. All right, okay. I got your text, no problem. But yeah, just, relating to the fact that, yes, this is something which is specific, but might not be required for, all individuals within the society, but very specific to people, say, for example, ladies or women in general, which go through this condition and obviously, go through the process of giving birth. So in those cases, we look at the concept of something called preventive medical approaches, and that is where, this is something which also needs promotion, but the promotion is done specifically towards women because they undergo through this process of, obviously giving birth and, being that, going through that particular whole process. Now, the other bits and pieces that we look at in particular is, we will look at some of the national campaigns. Just to give you an idea, there is a current campaign which the government is running on obesity in particular, heart conditions, breast cancer campaigns. And these campaigns, when you look at, are basically deciding on a particular strategy to make sure that people are able to take action at the right time to be able to improve the health, or stay to in order to basically not develop this condition. And this is where you will need maybe to take an example of one of the types of national awareness campaigns which NHS is running, and that is where this is where it will be important for you to pick this up, a particular campaign that you can think of, and bring it into your assignment for learning outcome 4. Because with that example, you'll be able to show the application of how healthcare promotion actually works within the national level, or maybe depending on the example that you pick at the local level. Is that okay?
Mm-hmm.
Right. So what I'm going to do is these are some of the slides that I'm going through. I'm just flicking through some of the slides. Reason is that these are just some points that you will be able to incorporate on your in your assignment report when you write. And these are some of the data points that you will be able to use while you're doing some of the tasks related to healthcare promotion. So I think the key part here to summarize is that you have to look at picking up a national campaign which you will need to bring in your work. So it could be a breast cancer campaign, obesity campaign, cardiovascular diseases or heart diseases campaign, which NHS is doing. Promotion in terms of campaigns or promotions in terms of looking at how to reduce the consumption of alcohol amongst the youth is also being run. And there is a website that I will send on the email to you, which will be which will give you a link and some background knowledge in terms of what are the current campaigns which are currently being funded by the NHS and also by the private sector, wherein they are looking at tackling this problem of say for example obesity and alcoholism and drug use in particular at this stage. Okay. Good stuff. So what I'm going to do is obviously stop today's session here, and then also send you a particular handout which will be for additional reading. And this particular handout, when I send this to you, would basically look at giving you some background in terms of the healthcare promotion framework, and also give you some reading bit material in terms of understanding the current campaigns which the government is currently running. Is that okay?
Okay.
I'll have to stop here, Naima, because I have a call which is coming on, and what I'm going to do is obviously send this email on to you pretty much after the session, And then if you have any